On behalf of the Centers of Medicare and Medicaid Services, the Administration for Community Living, and the Indian Health Service, I would like to welcome everyone to the Long-Term Services and Supports webinar series. My name is Julie Cahoon, and I work for Kaufman & Associates. I will be the moderator for today's webinar. Today's webinar is Money Follows the Person, Tribal Initiatives, Part 2. Please note this webinar series is supported by a contract awarded by the Centers for Medicare and Medicaid Services. The opinions, findings, conclusions, and recommendations expressed in this webinar are those of the presenters and do not necessarily represent the official position or policies of the Department of Health and Human Services or the Centers for Medicare and Medicaid Services. We have two panelists with us today and our panel discussion facilitator. Our panelists today are Petra Harmon-Munhawk with the Standing Rock Sioux Tribe, and we also have Stephanie Jay from the Turtle Mountain Band of Chippewa Indians. Our facilitator today is Russell Coker from the Seminole Nation of Oklahoma. I will now turn it over to Russell to introduce us to today's discussion.
Good afternoon or good morning for some, and I bring you greetings from Oklahoma, where it is definitely summertime. Welcome to the next installment of the MFP-TI webinar series. We have a great lineup of presenters today, and we'll be featuring tribes participating in the MFP-TI from the great state of North Dakota, who have been working with a great friend of mine, Melissa, in developing and implementing their plans within the MFP-TI. So a little bit of background about the MFP-TI. For those of you who don't know, MFP stands for Money Follows the Person. And at my last reading or my last count, I think there are 46 states who are operating an MFP program. So which in a nutshell, and there's more to the MFP program than this, but in a nutshell, it assists in moving people back to the community from institutional settings to receive their LTSS, which in turn saves the states money in providing members their services in their own residences. And as the MFP program has proven over and over, people do way much better in the community versus an institutional setting. So the MFP is a great program, and I also work closely with my state's MFP program here in Oklahoma. So from the original MFP came the MFP-TI, and as you can see on this slide, after all was said and done, we had 5 states who were awarded MFP-TI funding. Those states include Oklahoma, North Dakota, Wisconsin, Washington State, and Minnesota. So from those 5 states, we are currently working with 31 tribal nations who are coordinating across several levels of government, including tribal, state, federal, city, and urban. So the overall goal of the MFP-TI is for our participating tribes to establish sustainable and culturally appropriate long-term services and support in tribal communities. So the guiding principles for the participating 5 states are to promote government-to-government relations, enhance tribal infrastructure, increase access to needed services, address disparities, design and implement effective programs, and to maximize fiscal resources. As mentioned, 5 states are participating within the MFP-TI, so here's a quick look at the tribes that we are working with within our respective states. We will begin with the great state of Minnesota, North Dakota, Oklahoma, Washington State, Washington State continued, and finally, Wisconsin. So as we move to the panel presentation, a quick map of a quick visual of where today's presenters are located. Being born and raised here in Oklahoma, I can tell you that it's definitely summertime, but in looking at the map, I get cold all of a sudden. Looking at our most northern tribes here, especially the Turtle Mountain Band of Chippewa Indians, the northernmost tribes. So that gives you an idea of where the tribes who are presenting today are located. So with that, I will introduce our presenters for today from the state of North Dakota. First, we'll meet Petra Harmon One Hawk from the Standing Rock Sioux Tribe. So, Petra, could you introduce yourself and tell us a little bit about your work and your tribe?
Good afternoon. I'm the Title VI Director for the Standing Rock Sioux Tribe. When I was hired in as the Director for the Nutrition for the Elderly program. It's titled Nutrition for the Elderly / Caregiver Support Program. And then there's another elderly program that is known as Elderly Protection Program. And so under Money Follows the Person, I have put a proposal forward to the Tribal Council to merge both programs and create the Tribal Aging and Community Services Agency. My background is I have a bachelor's in biology. I completed 3 years of medical school and then have a master's in public health. So I'm really grateful to have this opportunity to actually build a program. And I was just looking at the objectives of Money Follows the Person, and it's right on. Each one of those objectives is all the needs that our tribe needs and is lacking. So don't want to carry on. That's all I have for now.
Thanks, Petra. And next we have Stephanie from Turtle Mountain. So Stephanie, will you introduce yourself? Tell us a little bit about yourself and your tribe.
Good afternoon, everyone, and thank you for joining today. My name is Stephanie J., and we are that little dot on the map that Russ had just shown previously. We are located in north central North Dakota. I come from a really small land base. Our tribal land base is 6 miles by 12 miles. However, we have about close to 15,000 members living on and near our reservation. I am a tribal health educator, and I have been since 2005. I am also the program manager for our newly created Tribal Aging Agency / QSP agency. And my credentialing includes, I have a business management degree, a bachelor's in business management, and I recently graduated from the North Dakota State University with a master's in public health.
Okay, thank you, Stephanie. So we'll move into the panel discussion now. So just a reminder, if you do have a question anytime during the discussion, to please enter that into the chat box as mentioned. So first question, we do have some stock questions that we present, but also looking for some interaction with our listeners. So if you have any questions, please enter those in the chat box. So first question, I'd like to start off on a good note. So I'd like for each of you to describe what thus far has been your biggest accomplishment in working with the MFP-TI. And we'll start with Stephanie.
Okay. Clearly, the biggest accomplishment and success is establishing an operational and sustainable home and community-based program for our tribal elders and disabled on my reservation. This will improve the quality of life for our tribal members and allow them to age in place within their home. We received our Medicaid provider number in June of 2019, and I'm happy to report that we received our first referral from our local county social service office for home and community-based services in February. Prior to COVID-19, we had 3 clients, and we began billing, which is our sustainable part of the project. Presently, my staff includes, I have an MFP-TI coordinator, 1.5 biller. I have a full-time biller and a part-time biller, full-time licensed practical nurse, 1 CHR / targeted case manager / QSP, and that person, the CHR, has been, I call her our star player in all of this. The targeted case management could not happen without the CHR, and we are waiting to onboard 2 qualified service providers. Right now, due to COVID, we have temporarily suspended our services because we fall under tribal policy, Therefore, we have suspended, but we are reopening our agency on July 7th.
Thank you, Stephanie. Petra, same question.
So as I mentioned before, our accomplishment is merging the elderly programs into one agency, and through Money Follows the Person, we're able to hire on new staff. We hired on a social worker, and we hired on an administrative assistant, and that's huge for us because when I was hired on, there's only 2 of us in the administrative office, and so it's very challenging to juggle the requirements for Title VI. And through Money Follows the Person, it's just creating that pathway for expanded services and really creating that comprehensive, providing a program that provides those comprehensive services, and just being able to navigate those services and working with the state. I think that is a really great accomplishment, is that having that relationship with the state and accessing their services for our people. And that's been made possible with Money Follows the Person.
All right, thank you, Petra. So we all know that working within our tribal communities, in addition to the accomplishments that we like to talk about, we also face challenges. So I'd like to ask both of you, if you could talk and discuss some of the challenges that you face in building your programs and your services. So, Petra, can you start us off? So one of the challenges, of course, is navigating the reimbursement process that Money Follows the Person TI has as a requirement in accessing how to make sure that our employees that we're billing our employee salaries and benefits to that grant. So just navigating that, and also just educating leadership on what we're trying to do and making sure that they're understanding the process that's going on, and then also really educating and being connected to the community so that they're aware of what's going on, and then being patient because it is a huge change. And so I was just talking about that this morning, is that I need to be understanding and patient with people if they get upset because the change is so huge. And so that's definitely a challenge, but change is good, and it definitely provides a lot of hope for people when they see that there is organization, a different organization that's coming out of this, and that there are services that are just in one location instead of them having to drive all over for their different services. Thank you, Petra. Stephanie?
I would have to agree with what Petra said. Navigating the application process to obtain a Medicaid provider number with the state was a huge challenge for me. Because in tribal communities, that's something that we just don't practice enough, is third-party billing. And to try to figure out that navigation process of which offices to talk to, I've had several instances in the beginning that I'd call one office and they would give me one piece of information, and I would start working on that and come up with another question, and they'd refer me then to another office where I would get another piece of information that didn't correlate with what I had previously been told. So when Melissa Reardon started working with us, she helped navigate that process much smoother because she has experience working at the North Dakota Department of Human Services. And I realized early on that this was a new endeavor for both the tribes and the state of North Dakota. No tribal community was a QSP agency. So I was told, when you become the QSP agency, perhaps you could help the other tribes then become QSP agencies or navigate the system for the billing and the Medicaid provider number. It was a learning venture for both organizations, tribal and the state, the North Dakota Department of Human Services. So one of the things that we did early on was we the tribes of North Dakota that are under MFP-TI banded together, and we thought that together we would learn and much quicker and come up with the questions we need asked of the state, and it really helped us early on. So we still get together a lot on the phone a lot. We get together in meetings. We were having moving meetings from reservation to reservation. So I know Petra very well through the MFP-TI. I know Red Fox very well from the MHA Nation in Newtown, North Dakota. And this was all possible with our program administrator, Melissa Riordan.
Thank you, Stephanie. One of the great things about the MFP-TI, in my opinion, is the opportunity for our tribes to incorporate cultural and or traditional activities. So can you talk about some of the traditional or cultural activities you incorporate into your programs and services? Stephanie?
Right now, we're really in our infancy of the agency, but with the cultural, working with Melissa, I'm going to start there. Working with Melissa, she has built such great rapport with our tribe. She's worked through, I think this is the third administration, because I believe she came on board in 2014. So, and we go by 2-year increments, our administration. So she's worked through 3 of them, and her ability to build the rapport and then the trust with us for the cultural part of it, she has been exceptional in that area, going above and beyond, wanting to learn our culture. So in turn, for us to incorporate those kind of things into our agency is something that we would like to take from at a legislative standpoint, I'll say, because right now for some of our billing, we cannot do the socialization and cultural that we would like to do. Powwows, sweats, taking our elders to those bridging those. So that's something I think from a legislative standpoint that we go to tribal consultation meetings that we can address.
All right, thanks, Stephanie. Petra?
So what addressing what we have been able to do in regards to bringing in culturally appropriate services is that by absorbing by combining the programs, I have inherited one of the employees who is fluent in our language, and then the new administrative assistant that we hired is semi-fluent. He understands the language and but doesn't speak it. And so I had the conversation with him this morning that when our elders call, just state to them that you do understand the language so that they can switch into Lakota or Dakota, because they're oftentimes they're able to express themselves better in our traditional language. And then also hiring him on, it's important that we have women and men working in our program because of the cultural belief that when it comes to health care, it's the women who take care of the women's health, and then it's the men who take care of the men's health. But always giving our people that option on who they're comfortable with. So we're not going to force that on them, but that they have the option and that they can pick their provider on depending on who they're more comfortable with. So to me, that's really important. And then just piggybacking off of what Stephanie said in regards to the work that Melissa has done with us is that we're able to tailor our programs how we see fit in how they're going to serve our community. So not forcing a design upon us, but that we get to design our programs based on our needs.
Okay, thank you, Petra. As tribal nations, we talk about the importance of tribal sovereignty, not only within our tribal nations, but also within the work that we do. And I think Stephanie touched on that when she mentioned working with the state. So could you share some thoughts about working with federal, state, and even county partners as far as tribal sovereignty goes? Stephanie?
one of the things that I think is very pertinent when working with other agencies is having them understand our tribal reservation way of life. And I believe that over time, working with the MFP-TI initiative, that we have built some great partnerships with our local county office, with the state office, and then of course with the CMS, because we've attended many trainings and we know a lot of the officials that work through the agency. You know, building that rapport is really, really important, and them respecting our sovereignty. And as Petra had mentioned, you know, that's really important, that MFP-TI allowed us to build the kind of program that we see fit for our community, instead of giving us this design that we have to follow, you know, because each of our programs that we have, and the three that are in North Dakota, are all different. They're not the same, but they fit each of our tribal nations. And one of the things, you know, Rolette County Social Services is about 8 miles to the east of us, and there's a lot more, I believe, tribal elders that should be qualified. And they are qualified and should be on Medicaid and are not, but it may be because of off-reservation. It's an off-reservation office. So for Shelley to come over, she was the HCBS manager, and she moved up to supervisor now. But when she was a manager, she would actually come to our offices and come and visit with us, and that meant a lot, that she respected, you know, the relationship that we had, enough to come to us instead of us always going to them. So that's about it.
Right, thanks, Stephanie. Petra?
So the issue with tribal sovereignty, the way that money follows the person's TI is set up, and then also I saw a question on there in regards to 100% FMAP. You know, it's the same issue in the way that Medicaid is set up. It's set up through block grant through the state. I mean, each state is given the block grant, and so it was hard to convince leadership to come on board with the way it was set up, because the uncomfortable feeling that was felt was that we are then being subjected to the state, and then we have to have the state plan. But I also saw it as an opportunity where there is finally a negotiation table in regards to the 100% FMAP, and then through Money Follows the Person Tribal Initiative, in that we're designing the program. We're building a program based on our needs. And we were able to get our tribal leadership on board, but that is still an ongoing issue, because the state also needs to have that cultural competency training and the background on treaties, and that the way that CMS is set up, it is a violation of our treaty rights, because we're supposed to be government to government with the federal government. And so what the state and the tribal leadership need to really understand is that this is to look at it in a form of collaboration, that this is collaboration. And the one piece that I always talk about that I really appreciate is that through this program and through my program is that I am able to provide services not just for our tribal members or people from other tribes, but that I can serve non-Indian people too. If they choose our program, we can provide services for them, and I feel that that's really important because of the rural areas that we live in, and that services are so limited. So for me, that's really important, and that's something that I push when talking about this. And then also one of the other points that I share with people is that in the long term is to not just serve the elders 60 years and over, but to add on those with handicaps and disabilities, and then also the vulnerable adults. So those are the big dreams, to actually provide services for those groups of people too, because they're falling through the cracks, and we don't have programs specific for them through the tribe right now. So.
All right, thank you, Petra. And I wanted to piggyback off your response, if I could, because I'm sure we have some listeners or even some service providers listening in. So if there's any advice that you could give them, those who are interested in working or partnering with your tribal nations, how do you approach that? Or what advice do you give to, I guess, non-natives or perhaps those who have never worked with native people before? What advice could you give them? Stephanie?
I would say, let's see, that every tribal nation is unique and has different traditions and culture. There are presently 574 federally recognized tribal nations, and each one of us are different. We welcome the state offices and employees to our tribal lands, to learn who we are. And I believe that's the most important part, is to learn who we are. And again, I'm going to circle back to talking with about our state MFP-TI administrator, Melissa. She has the work she has done in our tribal communities is phenomenal. Throughout this journey, she has just been wonderful. She is really the perfect example of how cultural sensitivity and awareness should be practiced in tribal communities. She has taken the time to learn about who we are through visits. She wants to learn our cultures and our traditions. She has great rapport with our tribal health director, with our leaders. One of our tribal leaders is a health liaison. His name is Nathan Davis, and she has a great relationship with him. She's built that trust that bridges us to state organizations. Her knowledge of the state organizational structure was really significant for her benefit to navigating the whole third-party billing process for us. And with her experience, knowledge, and compassion, we created the infrastructure and capacity that for our program that will serve our community, elders and disabled, and will sustain our efforts through third-party billing. So my takeaway would be just to get to know what tribal community, identify an employee, and get to know that employee to help you then, an outsider, navigate the tribal community and organizations.
Thank you, Stephanie. Petra, same question.
So when I work with new partners or I'm just meeting people, I often do a quick evaluation of where they're at. I'll ask them questions on what is your cultural competency background, what kind of trainings have you had, have you worked in Indian country, are you familiar with the funding mechanisms for Indian country, and then I also ask them if they've read the book White Fragility by Robin DiAngelo. And by asking those questions, I'm able to gauge where they're at in regards to cultural competency and their own awareness of white supremacy and racism. Because if I don't do that, then I'm not sure what barriers I'm going to have to overcome in working with them. And then if they haven't read the book, I often recommend that they read that book before we get started, so that they have an awareness of how how the United States system is set up, and that they're not treating me like they're my boss or my supervisor or my oversight office. And then if they don't have a quick history, I'll recommend some books for them. Bury My Heart at Wounded Knee is a good one. And then also some documentaries. There's a Eloise Cobell documentary called 100 Years, and it's how the Bureau of Indian Affairs had taken a lot of the resources so that they understand the historical context of why our people are faced with the socioeconomic conditions that we're now in, and that this is what we have to work with, and this is our infrastructure, and it didn't happen by accident, and that there was reasons for it, and that we need help to rebuild our infrastructure. We need help to put systems in place so that we can actually be functional programs and provide adequate services and have enough funding and resources to do what we need to do.
Thank you, Petra. So since our last MFP-TI webinar, this is the first time I get to ask this question because, as you all know, our world's been upended by COVID. So I wanted to give some time to that too. So we all know the impact of COVID within the nation and the world for that matter. But can you discuss how COVID has affected not only your MFP-TI program, but your tribes overall? So I guess I'm asking, how is your tribe dealing with COVID? Petra, you can go first.
So when I think of programs, and I'll speak from my own program, is that we already had a program that was operating in crisis mode, and we were fortunate that we had vendors that had helped us all along. They were patient with us in paying bills, and when this pandemic hit, it crippled us. It crippled us because we were not already functioning at capacity, and the vendors were not able to help us like how they helped us in the past, because they had to have their bills. We had to have our bills up to date, and then not all businesses are functioning at full capacity themselves. And so on a whole, for the tribes, our program really represents the tribe as a whole, because where we should have been able to start at ground zero, we're starting at a deficit because we don't have those systems in place. And so it's been really challenging, and we're just really fortunate that our numbers, they're going up now, but they haven't gone up. And then also that we just don't have the funding or the money available to start putting those systems in place. And so we're really left scrambling. And it's very difficult because I have had pandemic training through medical school, but I think for pandemic training for your average tribal worker just seems so far off the radar. And so it's really tough because the public health infrastructure is just not there on the tribal level. And then not all states have it there. And then as we're seeing in our country, it's not there. And so as a result, we've all been caught off guard. And so I feel bad because I feel like people should have had trainings in place. And then, of course, we're in a food desert. So when the trucks stop coming, the food stopped coming, but the positive part of that is that we still have people who know how to butcher, we still have people who know how to garden, and so really kicking those things in place, and then also just regaining that confidence in ourselves that we can do this, we can take care of our people, and we can figure it out with the limited resources that we have, because that's how we have been able to survive all along.
Thank you, Petra. Stephanie?
I would just reiterate exactly what Petra said. I think all tribal communities are feeling the same thing. We presently I had mentioned earlier, our Turtle Mountain tribe is still closed down. We were doing telecommute up until this past Friday, and we are back to work. However, not reopened, and our reopen date is July 7th. I believe we're the only casino. We own 2 casinos, one in the Trenton, North Dakota area, and that's out west near the Montana border. And we also have a casino located on our tribal lands, and both casinos are still remain closed. That put quite a few, I'd say close to 400 employees out of work on unemployment. The food issue was that we see locally. We have one grocery store on the reservation, and you see the increased prices, especially in meat, in beef, because of the meat packaging plants that were shut down in the nation. One of the things that I believe COVID did teach us is the need for public health infrastructure. During the telecommute, I was, because the agency, the Tribal Aging Agency was suspended, the services were suspended, so I jumped on board with grant writing, and our tribe decided to write for Emergency Operations Center, and we're happy to say that was partially funded. We're awaiting what the second disbursement is going to be. Another initiative that we felt that would be beneficial is to purchase a mobile health clinic. So we are moving forward with that. I think, as Petra had said, is the biggest part is the public health infrastructure. And it opened the eyes of our tribal leaders, of our hospital administration, of how we need to do a better plan of putting more money into public health.
Thank you, Stephanie. So, next question, and we're winding down the question part. What kind of one of you mentioned this earlier, but what kind of support did you get in the building of your program, and what kind of support are you getting now that you're implementing your program? Stephanie?
Okay, for the support part of it, we have, I believe that our MFP-TI program had started back in 2014, and the Tribal Council back then had, through resolution, had decided to engage in proceeding with Money Follows the Person Tribal Initiative. And we've been through 3 administrations. Our CHR employees, that's a partnership that we have with that department. Otherwise, we would not be able to do the targeted case management as, according to our North Dakota legislation, you have to have 120 hours of the community health representative modules completed to be able to do a targeted case management assessment on a Medicaid client. So that is huge for us, because when we're able to do that CHR goes out and does that initial assessment, they are able to bill at the IHS encounter rate. So that is a huge part. And through supports of our tribal health director also, that because I'm a health educator, and when I heard about that QSP agency was from Dr. Don Warren, and I know a lot of people are familiar with him. He came to visit our reservation and kind of educated us on what it is and how we can create agencies within our CHR department. Because under Chapter 16, I believe it is in the IHS manual, that they're allowable to do homemaker services, transportation services, personal care. So once he came, I kind of reached out to the tribal health director and said, I'd like to take on this initiative. Not that I was given the initiative. It really, when I know that there's 2,200, 62 and over elders on our reservation, that really sparked an interest and compassion for me to provide services to our local elders. So we have the support, and again, this wouldn't all be possible without the funding mechanism from the MFP-TI and CMS, because often in tribal communities, the sustainability of grant programs are really, really hard, and they start off strong, and you don't have that sustainability piece. They fall apart, and everything resorts back to what it was. So I'm really very, very grateful for the supports of CMS to recognize the services that are needed in tribal communities.
Thank you, Stephanie. Petra?
So the support that I have received comes from being a tribal member and growing up here. And so when I was first hired in, and I reported to my oversight committee, which is the Health, Education, Welfare Committee for our tribal council. They're a subcommittee. The chairman of that committee, shared a story about when I was a little girl and I was in school, because he was an educator back then. And so just having that relationship with some of the leadership in that, having that lifetime connection has been important, but also, like Stephanie shared, that the funding. So doing the educational piece, bringing in Elena Seats to do an educational presentation to our leadership and to the different directors, and really sharing with them what this program can, or what this initiative can do for our program. But it really came down to when the program was awarded that it cemented that trust that I'm not just trying to sell them something, that I'm actually sharing with them this education, but I'm also pursuing it, and that there is actual funding to help us get off the ground. And then also, making the proposal to take over the elderly protection program and looking at their budget and just sharing with them that, this program is not sustainable. It's 100% tribally funded, but it keeps receiving it. Budget cuts keep happening for the program, to the point that when I was able to get the budget, there is only $9,000 in the operating cost part of the grant, which was the rest was going for employee costs. And so how do you manage a program only on $9,000? It's not sustainable at all. And so asking the tribal council to merge the two programs, because we are duplicating services, but that through Money Follows the Person TI, we're pursuing a path to sustainability to strengthen our program. And so just for them to actually see it on paper and see it in person, that this program is developing and expanding, really develops that trust and that support from tribal leadership.
Thank you, Petra. And for my last question, it's actually not a question, but I always like to give our presenters a chance at some closing remarks. So, Stephanie, do you have any closing remarks?
No, just like to thank everyone for participating today, and I'm very, as I mentioned earlier, very grateful to the funding that has been provided to create these much-needed services in tribal communities. When I, as I mentioned, I have 2,200 62-year and older, and you compare that to the life expectancy of American Indians in North Dakota, they're 20 years less than those of white person. So we have a lot of work to do. And when we can grab money to fund projects that will improve the quality of life for our tribal members, that is what we do. And I'm just grateful for being allowed to do the work that I am doing. Thank you.
Thank you, Stephanie. Petra?
I just want to address that there was a question that says, do you have any suggestions for social distance alternatives to in-person socialization for our elders? And so one of the things that we did was a lot of our cooks for our program are 60 years and over, and out of concern for their protection, we had them work from home, and that they were tasked with reaching out to the elders and calling them, and just even if you're just visiting with them, log it so that they're connected to somebody. The other idea I had was to do, like a drive-in movie. We just haven't gotten to that, but just really asking the community to check on the elders, cook for your elders in your family. If you know of an elder that doesn't have family, go out and ask them if they need help, if they need anything. And so really promoting that outreach for them. And then in closing remarks, I wanted to share that Stephanie and I went through the same program, and our concentration is in American Indian health. And to me, the biggest benefit out of that program was learning about the funding mechanisms in Indian country. And I just came in hired in at the right time, in the right place as a Title VI director, and through Cynthia LeCount's initiative also is to really go after the direct billing, to go after those Medicaid dollars. And so one of the things we learned in our master's program is that your Indian Health Service, your BIA, they have never been fully funded. They have never been funded over 50%. And so they're not fully functional programs. We're severely underfunded. We're severely understaffed. And so not being able to provide adequate services is not by accident. And then also, you know, the people sharing that with the people in the elders, that this is the reason why we're pursuing direct billing to Medicaid and building our programs, is because there's never adequate funding through the programs or the services, the federal agencies that are supposed to provide these services. And so instead of waiting for that funding to be at 100%, which has never happened before, this is another avenue. And so through Title VI training, when we were talking about CMS dollars, the key takeaway for me from our last conference was that 1 year's budget of IHS is equivalent to 2.5 days of CMS's budget. That's how severely underfunded we are. And so it is incumbent upon us to pursue this, because our people deserve to have adequate resources and adequate access to services. So those are my closing remarks. Thank you for this opportunity.
All right, thank you, Petra. And again, big thanks to Petra and Stephanie for joining us today, taking time out of their busy schedules to join us. So, in closing, as was mentioned, we recognize that today there are 574 federally recognized tribes in the U.S., which each nation possessing their own customs, culture, and history. So it is hoped by the 5 states that our work with our tribes can assist and even be replicated in various tribes around the Indian country who might be looking for assistance in developing and providing long-term care services to their tribal members. So with that in mind, here are the 5 MFP-TI state contacts in case anyone's needing to contact any of us. And in closing, I say Mado, which is how we say thank you in Seminole. And with that, I will turn it back over to Julie for any further questions.
Great. Thank you, Russ, and thank you to our panelists. We do have a few moments to reserve for a question and answer session. So if you do have any questions for our panelists today, please type those into the Q&A pod, again, located at the bottom right side of your screen. Okay, so our first question is, and I'll go ahead and direct this towards Stephanie first. Do you have data specific to people with intellectual or developmental disabilities and MFP-TI?
Right now, in our tribal community, we have an organization that collects all of our data. I believe our tribe is the only tribe in the nation that has our own data repository. The name of it is Tribal Nations Research Group, TNRG. And the data that we would get would come from them, specific with, I'm reading the question now, do you have any data specific to people with intellectual developmental disabilities and MFP-TI? Any data that I would need, I would get from them. I haven't really based the work on that data. It's been specifically for elders. However, I believe that I would be able to obtain it. I'm sorry I couldn't answer that question fully for whoever it was. Maybe Petra would have some information on it also.
Petra, would you like to respond to the question?
So I wouldn't say that we have a good database yet in regards to people with intellectual and developmental disabilities, but by taking over elderly protection program, we have learned that the program was also providing services to vulnerable adults. So we do have some that are under 60. So we do have some clients that are on our program, but we don't have a set database just yet, and we're working on that.
Okay, great. And so the next question, and again, I'll go ahead and just direct this towards Stephanie first and then Petra. The question is, if your programs meet the requirements for 100% FMAP eligibility, have you worked with your state to try to negotiate an enhanced rate?
Yes. The program that we work under, the 100% FMAP, I believe Petra had answered this one already earlier for FMAP eligibility. Petra, is this the one that you answered?
I mentioned it somewhat. I mean, of course, we can expand on that, but you can give some of the historical background. Like we haven't even discussed long-term support services with the state yet, and having an enhanced rate.
In North Dakota, the tribes are engaging in care coordination agreements between our IHSs or our 638 tribal clinics and the state. However, like Petra had mentioned, we haven't touched, we know we can, but we haven't had those discussions yet for LTSS services and 100% FMAP eligibility.
Okay, great. So we do have time for one more question. And the question is, do you have any suggestions for social distance alternatives to in-person socialization for elders? And Petra, I'll go ahead and let you respond first.
I offered a few suggestions, but I think it, one of the things I was actually sharing with my mother, and in regards to what I know about in other pandemics and how people, what were the best practices for pandemics, and that was going door to door. So any information that should be provided should actually be people going door to door. And I think that, just going to somebody's house or going to check on that elder, calling them ahead of time, or even, knocking on the door and then moving back 6 feet and then delivering whatever they need so that they're seeing people face to face. It's really ironic because I see the push for technology and getting people those services. That's the big push, but the best practices, the best practice for containment and addressing quarantine and isolation in regards to pandemics is actually going door to door.
Great, thank you. And Stephanie, do you have anything additional to add?
Yes. For the socialization and alternative, I know that I've seen happening is the use of technology, FaceTiming. Just don't forget about the elders. They are the ones that are most vulnerable during the pandemic, the targeted group to practice precautionary measures with or create those contact lists of elders and check up on them, call them daily to see if they have any needs. And I know CHR departments are good at doing that because they have the rapport already built with the tribal elders. Everybody knows the CHRs in the community. So right now, I think my suggestion would be just to try to keep in contact with them through telephone or encourage relatives to also stop in and check in on them and have those contact lists for the program staff to give them that friendly phone call.
Great. Thank you so much. And so we have come to the end of our question and answer session. And so I would like to thank our panelists for joining us today and sharing information about how their communities are implementing services for home and community-based care through the Money Follows the Person Tribal Initiative. In closing, I'd like to remind everyone that today's webinar was recorded and that the audio and presentation slides will be made available online at cms.gov on the Tribal LTSS Technical Assistance Center website. Thank you again for joining today's webinar. Our session is now concluded.